about today. So my focus the last couple of decades, I guess, has been really on children and youth, and particularly in communities facing adversity. And I've been drawn time and time again to youth and children in mining communities because we see some of the most significant disparities globally in mining communities, and the really difficult effects of mining and how they're affecting communities. So I'm going to give you some insights from my experience working in the Canadian North, but also a little bit from my experience working in Mongolia and more recently in Zambia. I'll give you a little bit of a brief introduction about why I call mining and community health impacts wicked problems, and then I just focus on the child and youth determinants. I'll talk a little bit about what the literature says, and then what our own work in doing interviews and speaking with people in communities says, and then just end off with some articulation of sort of challenges and future directions. So as we know, mine development has affected communities for as long as we've had mines, and of course, the effects of mining are very complex. What I'm always talking about is how difficult and complex the problems are for everyone in community, including children and youth. And I call them wicked problems because, wicked problems, as you're trying to solve them, it's not clear what solutions there are. It's not clear sometimes even how to get to a solution. If you do choose a solution or action, then you end up sometimes causing negative impacts for some in the population and positive for others. Sometimes we find that the solutions cause way more problems that you then have to solve as well. So these wicked problems make dealing with the effects of mining on communities just that much more complex. And what I'm focusing on is sort of the impacts for children and youth. So why are they wicked? Well, they're not uniform. They're both positive and negative. It can be difficult to assess. They have to be viewed cumulatively, and oftentimes our studies and the effects themselves are caused by factors or impacts that are not that are working together. So our accumulation has to happen on the solution side or at the assessment side. The historical context is important, the type of mine, and even the life of the mine. And we know that the mine cycle has a huge impact on the effects that are felt by community. So at what stage is the mine and what type of mine can have major impacts on community. So children and youth have to really be considered as a unique subpopulation in mining communities. There's lots of reasons for that, but one of the ways that I explain it, I think, is through the life course perspective. So this idea that there are these vulnerable time windows, and that different populations are being affected by the mine in different ways depending on their age at the time. And that's because we have developmental, literally interior to the body and mind, aspects at different points in our lives, but we also have different behaviors at different points in our lives. We have different occupations or places we spend our time. And because of this, we have different exposures. And we end up becoming both affected by our family and our parents, as well as, of course, our own lives. And as we get older, we then affect our own children. And so when we're thinking about the effects of mining, to overlap the life courses thinking is really, really important. And that's what that's what I'll talk a little bit about today in terms of focusing specifically on children and adolescents in mine communities. So I'm going to draw from two different types of evidence, I guess. The first is literature review and existing literature around mining effects. And the second is community-based work, talking to people in community and people working at mines. So this is almost a decade ago, we did a large scoping review looking at what are the effects of mines on communities, and then taking a subsection of that, looking at children and youth. And I remember at the time it being an overwhelming experience because there was so much dramatic amount of literature, and just kind of taking it apart because there were impacts across the whole spectrum, from health to social life to family life to business to occupation, on and on and on. And so we call this literature review database, I get the swamp, because it literally was such a wet and messy place. But when we looked at the swamp and we continued over the last 10 years, continuing to look at the literature base related to impacts of mines on children and youth, particularly, we have tended to, and researchers and myself included, have tended to kind of homogenize individual experiences within communities. And yet that is not the there are individuals in community impacted very different from the next individual. There have been some simplistic cause and effect thinking related to the effects of being, and there's been a risk on proximal or closed determinants versus distal ones. So for example, we see a lot, and this continues to today, we see a lot of research related to contaminants and environmental degradation. So for children, of course, and adolescents, they are impacted by air, water, and soil contaminants related to mining. And of course, they are impacted by those contaminants in their environment that over time influence their food sources, their water sources, and the air they breathe, etc. There's also the occupational hazards. And of course, as youth become, or even children in some places, become miners themselves, whether artisanal miners or formal miners, they have the occupational hazard of being a miner. And so we see research on ailments to the skin, to the eyes, respiratory illnesses, and things like that. And so there's quite a bit of literature indicating that children can be at a higher risk, and adolescents at a higher risk for accident and injuries in mines, for example. And also because of their brain development and their age, they may be at heightened risk for exposure to toxic chemicals and other things. But we know this is Dahlgren and Whitehead's model for the determinants of health. And so the red part in the middle here, this is the individual constitutional factors. So that very proximal to yourself, your body, your mind. That's just one component of all the things that cause us to be healthy or unhealthy. And so these very close things, although very important, can't be the only thing we end up studying. And in environmental impact assessment, if we're guided by EIAs, and their conceptualization of health, we often get boxed in to this idea that it's those proximal, contaminant, and occupational kind of influences that we have to really emphasize. But you can tell by just looking at this model that we understand that mining in communities has a diverse influence on the people who live both in proximity, but also could be working or influenced by the broader business and social structures that change because mines develop in community. So I was interested in this aspect. As a social epidemiologist, I'm very interested in social and societal determinants of health and the health of groups and populations and communities. I'm also interested in health equity or inequity and why particular behaviors, exposures differ between groups, right? And it really is a unfortunate marriage in a way, because in mining communities, we see a lot of these disparities. And we also see this a little bit of this masking of our understanding of health impacts because we're not kind of going beyond into the social and societal determinants. So when we're thinking about the health impacts on children and adolescents in mining communities, we really have to be thinking much more broadly about what how their health is being influenced, their own employment and income, but also their families' employment and income, their own mental health, but also their families and friends' mental health, the mental health in the whole community, gender inequity, social disruption, conflict in community, transient population, and the influx of and population change during the stages of mine development, cultural and spiritual disruption. And all of these are these broader determinants that have real life lasting impacts and can be positive, but can be negative as well. So some of the specific determinants that we see for mining communities and adolescents include changes in employment, the schedule of people's lives, the income and spending that's available or patterns of that, behaviors related to it, the existence or non-existence of different small businesses, formal education, the makeup of the population, crime and social issues in community, a change in language, land, just what youth there are in the community, as well as what they can do as a youth. Self-control and empowerment from communities. And really, this is the last one I'm going to move into our work related to Baker Lake, which is a community in Nunavut that is at the edge of Meadowbank gold mine. So over the last about 10 years or so, there's been a lot of focus on community health and um, understanding the effects of the Meadowbank gold mine on Baker Lake, but also the region. And my interest has been in understanding community impacts across Northwest Territories and Nunavut, really. But I spent some time in Baker Lake and was able to speak with people in the community about their thoughts related to impacts of mining on youth and adolescents, and also speak to people who are working at Meadowbank. So just to give you a sense, Meadowbank is in this area of Nunavut, but there's, so many mines across Canada. And as I mentioned, I also have been working a little bit in Mongolia and in Zambia related to mining communities as well. So one of the major changes we're seeing that are affecting children and youth is just the change of population. And what I want to really focus out is that some of it is positive, some of it's negative, simultaneously happening. So we see a change in family life because of population, the change in new people, increasing there's this idea that there's sort of a blame of these new folks coming in and bringing in with them different drug and alcohol sales or usage, residents living in overcrowded homes, construction in the town moving fast but not fast enough, etc. So you can see the complexity of the determinants and how children and youth are being impacted both negatively and positively by these complex influences. Employment similarly. So again, I was saying that youth are employed themselves, but also their parents and friends and family members, grandparents. And so unemployment rates go down in my communities often, but there may be improved job access and pay for jobs. However, there might be lack of training among local people. Impact and benefit agreements sometimes help with that. But then the success of mining employment might not always be there if you don't have the right experience, or it's not, it might be incompatible with the life that you want to choose, your family structure, inability to find childcare, etc. So I hope that I'm kind of giving you the sense of the complexity of the influences. New family schedules as well, mixed reactions to the shift on, shift off, some children not having supervision, other children being positively impacted because they've shifted the role of their house and they're having exposure to one parent, they have more income in their home, etc. And then the last, because I was mentioning about the employment, of course, income and spending, major changes in income in mining communities, sometimes in the boom and bust cycle that can be really difficult to manage, changes in consumer goods, food insecurity, right? We don't want people experiencing food insecurity, but then we end up seeing more vehicles, potentially more accidents, increased demand for gas, more dust, people paying down debt sometimes, but also people getting into gambling, etc. So that's just the complexity. How do these, I'm almost wrapped up here, and I wanted to just bring it around to how do these patterns for children and youth how do they compare with my international understanding? And, really there's a lot of similarities. There are, of course, specific differences in communities, and every community is different, every mine is different, but there's a lot of overlap in some of the messages that I'm sharing today. So what are the actions that are needed? I really just think I'm just going to emphasize two major actions today that over the last sort of 20 years, I said, if we just continue to recognize that the effects of mining across the life course and children and youth as a subpopulation are important to keep emphasizing. So this idea of life course, that not, the community is not uniform, and children and youth have to be a major focus. And then really the major message of today's presentation for me is that we have to continue to recognize the broad health impacts of mining and not get comfortable in our assessments of those more proximal or close determinants. Really start to imagine and just continue to discuss the broader impacts. So that's my address if people like to read out afterwards and ask more questions. And also I'll be here, of course, for the questions and answers afterwards. Thanks, everyone.